So our next session will be on the impact of AI on medical practices, present and future. So I have the pleasure of welcoming Dr. Piyalitt Ittichaiwong, who will be live on Zoom from the United Kingdom. So he is a professional at the intersection of medicine and artificial intelligence. He earned his Doctor of Medicine degree from Siriraj Hospital, Mahidol University. And he then pursued a master's degree in healthcare technologies at King's College London, where he specialized in medical AI and graduated with distinction. Currently, he is a PhD candidate at the AI Centre for Value-Based Healthcare at King's College in London, focusing on research in generative AI in medicine.
Good afternoon, ladies and gentlemen. My name is Piyalitt Ittichaiwong from Sila Informatics and Data Innovation Center at Sila Hospital, Thailand. I would like to talk about impact of AI on medical practice, present and future, that I am sure it will be the easiest topic in this conference for experts like all of you, but I am sure that this topic will significantly help your clinical practice in the near future. Firstly, I am so sorry that I cannot be there because I am in the London right now. Yeah, but I am really honored to have opportunity to talk with all of you.
First of all, I would like to briefly introduce myself. I am a graduate of the Doctor of Medicine program from the Faculty of Medicine at Siriraj Hospital, Thailand. Following that, I pursued further studies in medical artificial intelligence, completing a master's with distinction and currently working on a PhD at King's College London, with a focus on generative AI in the healthcare domain. Before we proceed, I wish to declare a potential conflict of interest. I am a co-founder of Preceptor AI by Kariva, Thailand, where we aim to leverage AI technologies to empower healthcare professionals. Throughout my talk today, I will be touching upon some of the products and innovations developed by Preceptor AI, which I believe will help illustrate the transformative potential of AI in medicine. My purpose here is not just to share insights into medical AI, but also to demonstrate that as ASEAN physicians and innovators, we have the capacity to create meaningful AI solutions ourselves. If we look at the progress of large language models, LLMs, in answering medical questions, particularly in the context of the USMLE, one of the most challenging medical exams, we see an extraordinary leap in capabilities. Let me direct your attention to this graph. Just 2 years ago, in March 2022, we had BioLink BERT, an AI model that achieved a score of 45.1% on MedQA, which is a USMLE-like exam. This performance was roughly equivalent to that of a student struggling to pass. Now, fast forward to early 2024, we see a new entrant, MedGemini by Google, which has pushed the boundary to an incredible 91.1%. This score is equivalent to the 99.9 percentiles among human testers, a level of performance that signifies near-perfect understanding. However, it is important to note that this is merely exam performance and does not necessarily translate to real-world clinical practice. So, why am I so confident in my perspective? Well, I've had first-hand experience working as a part-time member of the Red Team for OpenAI during the development of GPT-4. My role involved assessing the model's safety and reliability, especially in the context of its application to clinical practice. We weren't just focusing on simple multiple-choice questions like those used in MedQA. We also evaluated more complex tasks, such as open-ended questions. In these scenarios, it became clear that the model still struggles significantly. It often produces hallucinations, providing incorrect information with unwarranted confidence as if it's an expert. This is particularly problematic in medicine, where incorrect answers can have serious consequences. Additionally, the model would sometimes generate references that simply do not exist, further eroding trust in its outputs. These experiences have highlighted for me the critical areas where AI in healthcare must improve before it can be fully trusted in clinical settings. However, at first, I think everyone thinks that we may use the large language model to solve many public health problems, such as one of the major limitations facing healthcare systems in ASEAN countries is the low doctor-to-population ratio, particularly in the public sector. Let me draw your attention to some stark numbers illustrated on this slide. In Thailand, we have only 0.5 doctors per 1,000 people in the public healthcare system. The Philippines has a slightly higher ratio at 0.6, while Malaysia manages 1.5. Globally, the average stands at 1.7, and our numbers fall well below that benchmark. This shortage has profound implications for the quality of healthcare provided. Patients face long waiting times, and 10% of medical errors could potentially be life-threatening due to the burden on overworked medical staff. However, I believe we can still solve this problem by utilizing the large language model without being directly involved in clinical decisions. One potential solution to address these challenges in the short term is leveraging AI to assist with repetitive or routine tasks. By employing AI to handle administrative duties, especially document work, we can free up valuable time for doctors. This allows them to focus more on critical patient interactions and have the necessary time to rest and recover. Ultimately, such improvements could enhance patient outcomes, reduce waiting times, and create a more sustainable workload for healthcare providers. Integrating AI into these aspects of healthcare isn't about replacing doctors. Rather, it is about enhancing their efficiency and ensuring their time is spent where it matters most, with the patients who need them. Now, let's dive into how these two worlds, medicine and artificial intelligence, intersect. Both fields are incredibly complex, each demanding a deep understanding of its nuances and continuous evolution. To truly harness the power of AI in medicine, we realized that collaboration was key. We needed to bring together the best minds, medical professionals, and AI engineers to work in harmony. Our mission has been to create meaningful innovations by combining the medical expertise of physicians with the technical prowess of AI specialists. Right now, we're focusing on practical applications where large language models and medical AI can bring safe and effective change to healthcare. One significant area is reducing the administrative burden that healthcare professionals often face. By doing so, we allow them to focus more on patient care. We're also developing clinical tools that can assist in the management of common diseases. For instance, AI-powered symptom checkers are already being used to provide preliminary clinical guidance. These models, starting with deterministic approaches, offer a safe entry point into broader applications. By starting in these areas, we ensure that our innovations are both safe and reliable. Our aim is to make gradual, meaningful improvements that enhance healthcare delivery while building trust in AI systems along the way. So, I will introduce 3 examples of AI fields from 3 different modalities: audio, image, and text. Now, we have users: 60,000 minutes of audio usage, 1 million image usage, and 500,000 text usage. These examples can be helpful in real clinical practice. Okay, so next up, I want to show you something pretty personal in this image. You may have a question. Is this even readable? Honestly, I struggle with it too, and that's my handwriting. We've all dealt with the challenges of reading handwriting in medical notes, whether it's our own or someone else's, and it's not just a small inconvenience. It could lead to misunderstandings or even mistakes that could impact patient care. So I thought, why not use AI to help fix this? Not just for the patients, but to save our sanity as well. We developed an AI tool that can take what we say out loud and turn it into accurate, legible orders or patient notes. Imagine this: you're chatting with your patient, and instead of scribbling notes or struggling later to remember exactly what was said, the AI captures it all and instantly creates the record. No more confusion, no more guessing, and definitely no more trying to decipher my own scribbles. I apologize that the demo is presented in Thai. However, you can see that the AI can transcribe both Thai and English with a Thai accent. Let me summarize the key point. In healthcare, we often engage in what linguists call code switching, effortlessly shifting between English and our native language, such as Thai. This is common among health professionals, especially in technical discussions involving lab terminology and clinical concepts. The challenge, however, is that when our English accent deviates from standard British or American pronunciations, AI systems struggle with accurate speech-to-text conversion, particularly when dealing with specialized terms. Despite these challenges, our work demonstrates that advancements in AI have now enabled us to overcome these barriers. This progress means that AI technologies can indeed be effectively integrated into real clinical practice. Perhaps you're wondering if it actually works in real-life situations. Let me assure you, it definitely does. However, it's not perfect yet, but it greatly benefits healthcare professionals, not just doctors, but everyone who deals with handwritten documentation. Our AI, More ASR can cut doctors' manual typing time by 50%, drastically reducing administrative burdens. This allows doctors to spend more time on patient care, not paperwork, while improving workflow efficiency and reducing workload for all healthcare staff. We're also seeing real improvements in patient care quality. Less manual data entry means fewer errors and safer, more accurate records. With less time spent on data entry, doctors can focus more on what really matters: patient care. More ASR also supports digital transformation in healthcare, helping hospitals transition to fully digital systems and meet international standards like those from the Joint Commission International. This means higher quality care and more efficient digital practices. One major benefit is real-time communication. While a doctor examines a patient, more ASR captures their spoken notes accurately in real time. This system reduces documentation time to just over 5 minutes from the typical 9, providing a big leap in efficiency. Every saved minute goes back to patient care. In short, more ASR reduces administrative burdens, enhances patient safety, and drives healthcare's digital transformation. More ASR is just one example of how audio AI technologies can significantly improve our work. There are many more possibilities out there, and I believe we all here can develop good things like this to help our patients. Finally, this approach goes beyond simply transcribing the words of healthcare professionals. Our next significant milestone is about transforming complex medical information into content that patients can easily understand, irrespective of language barriers. As you can see in the diagram, we start with professionals, doctors, pharmacists, and other healthcare providers who generate crucial health information, such as doctor notes or prescriptions. The AI system transcribes, translates, and processes this information, making it accessible to patients in ways that are clear and comprehensible. The goal is to bridge the gap from professionals to the general public. We can see this transformation journey from healthcare workers speaking in English or Thai to AI interpreting and converting these complex inputs into something comprehensible. Not only doctors' notes, but also patient histories and personal health diaries are simplified, personalized, and ultimately presented in any language. This means we are moving towards empowering patients, ensuring that critical medical information, no matter how complex, is transformed into something that everyone can understand and use effectively. The direction is clear. Information flows from the professionals to the general public in an intuitive, supportive manner. But yes, this is just one modality. The next one that can help us significantly is computer vision. When we talk about computer vision, many of us think of AI applications in interpreting X-rays, which I believe resonates with most doctors here. Our hospital has partnered with a startup to bring this AI solution into practical use in Thailand since 2019, marking a significant step forward in integrating AI into routine medical practice. It is an invaluable tool, particularly for junior doctors, providing them with confidence and support. However, it's also true that ultimately the senior doctors, like all of you, still bear the responsibility to interpret the results and write the final report, so it will not help us much. Let me share an exciting development in the realm of medical AI. We are now far beyond the capabilities of AI from just a few years ago. Today, AI doesn't simply help interpret medical images, it can also generate complete, detailed reports, transforming the way we diagnose and communicate medical findings. In fact, I'm proud to share a story about our team of doctors here in ASEAN. We competed in the X-ray AI Report Generation Challenge and achieved an impressive 4th place ranking at one of the top AI conferences, ACL, last year. While we may not have surpassed Microsoft in terms of raw accuracy, our model had a unique strength. It was more than 4 times smaller. This compactness makes it highly efficient and accessible, particularly for environments where computational resources are limited. And yes, now we are also working for all gastrointestinal experts like you, applying the same technique to endoscopic images. You can see from this image that after taking a photo, the AI will generate a report for you. If you need to make any edits, you can simply use voice commands to modify the report. I believe this will be a tremendous help for all of you in the near future. It's important to note that AI applications today are not limited to the healthcare profession itself, but extend to empowering health literacy among the general public. Here, I'd like to highlight an application that we've successfully deployed within the Line platform. This tool has already reached over 1 million interactions, with users base of approximately 150,000 people. It serves as a valuable resource, providing health information and support to patients in ways that would be challenging to achieve through traditional in-person consultations alone. By automating health advice and reminders, we bridge the gap where time constraints often prevent us from offering comprehensive guidance to every patient. From this image, you can see how AI approximates nutritional content. The input doesn't just have to be images, it can also be in text form, similar to ChatGPT. However, our database will make the results more accurate than those of ChatGPT. I want to emphasize that while AI provides valuable insights, it does not claim to be 100% accurate, certainly not at the level of expertise that all of you in this room possess. However, when we consider foods from our partner chain restaurants, the nutritional information is directly provided by those establishments. This collaboration ensures a higher degree of reliability. Our ultimate goal is to continuously expand this high-quality dataset, allowing us to train and refine our models further. By doing so, we aim to develop an AI system that can deliver the most precise nutritional estimates tailored to meet the needs of patients across the ASEAN region. Yes, and for us as healthcare professionals, when we need our patients to strictly record their food and drink intake, this AI solution makes the process much easier. Patients can simply take photos of their meals and send them via the Line application. This approach not only simplifies the task for patients, but also benefits us as practitioners. We can access a dashboard as shown in the image, which summarizes the food and drink records over the follow-up period, providing us with a comprehensive overview for better monitoring and guidance. Finally, for the last modality, that is text. Although large language models, LLMs, still have challenges with hallucinations, our well-designed task-specific approach for medicine, particularly for tasks like differential diagnosis and lab interpretation, where clear rules can be applied, has significantly mitigated this issue. Now, let me introduce you to our model, Preceptor AI, which has been operational since April 2023. It is a Thai ASEAN-focused medical language model that we have trained extensively using over 100,000 instructions derived from real ASEAN medical practices in 4 key tasks. This localized and highly contextualized approach allows Preceptor AI to provide relevant region-specific assistance to healthcare professionals. Our model is empowered by cutting-edge techniques such agents, retrieval augmented generation, RAG, and in-context learning, ICL. Importantly, Preceptor AI is built on an open-source model that can be deployed on-premises to maintain privacy, thereby ensuring compliance with regional data protection standards. The results have been very promising so far. During the beta testing phase, Preceptor AI was used by 12,000 medical professionals, completing over 500,000 interactions. In terms of accuracy, we have achieved 93% accuracy across 220 common diseases, and the model has surpassed GPT-4 in differential diagnosis tasks. Preceptor AI has also been recognized for its impact and performance. Our platform has been awarded ISO 13485 and IEC 62304 certifications, underlining our commitment to high-quality healthcare technology. Additionally, it has won numerous awards in prestigious competitions hosted by world-class tech companies such as Meta and OpenAI. In short, we are pushing the boundaries of AI in medical practice by creating tools that can assist, augment, and enhance the capabilities of healthcare providers in a trustworthy and privacy-conscious manner. Finally, looking to the future, AI will be able to detect what has previously been nearly impossible for most doctors, requiring the expertise of specialists. As demonstrated here, AI can analyze an X-ray image like this one and determine information far beyond what the human eye could easily discern. For instance, this chest X-ray not only provides information about lung and heart anatomy, but advanced AI models are capable of predicting the patient's race, determining if the patient has diabetes, and estimating the ejection fraction, which reflects the heart's pumping efficiency. With the power of AI, we can screen more diseases from patients using low-cost investigations while still confirming diagnoses with gold standard tests. This is the kind of transformative leap we are looking at, one that fundamentally changes how we understand and interpret medical imaging for better healthcare outcomes. And as I conclude my talk today, I want to emphasize that what I have discussed is achievable by all of us because we are the same ASEAN doctors. You do not need to be part of a top university in the West or China to accomplish something like this. I am confident that together we can make significant advancements in the near future that will help our ASEAN patients. And if you have any questions, I am happy to answer, or you can send me a message on my Facebook or my email. Thank you.
Please go ahead, Professor Asoke.
Dr. Piyalitt, so the first question is, what is the time in London right now? Good morning, right?
It's 6 o'clock. Yeah, but okay.
It's Dr. Vilaychon from Bangkok, Thailand. So thank you so much for your wonderful talks. Thailand right now, we are in the medical hubs. We have a lot of medical tours, and we use a lot of the telemedicine. For long story short, would you please let us know that how much of the AI is going to be impact for the telemedicine in our near futures?
Okay, sure. First, normally for the telemedicine, we still need to do the take a note, right? And when we have to do the take note, I think it's use amount of time for us. For example, after we talk with the patient, we still need 3 to 5 minutes to take a note and to that have the good quality note for reimburse or for the good medical record. Yeah, but for now, if you use the AI for the audio, like I said, we can just talk with the patient. And finally, AI will transcribe your sound into the medical record, and you just edit around 1 minute. And finally, the all thing will finish. So I think it will help us in the many way, and also for the junior doctor, like the general practitioner. I think our AI that also confirmed by the many evidence that it can help the general practitioner to provide the differential diagnosis and can help the junior doctor to have the safety differential diagnosis.
Thank you so much, Professor Travis. We have a UK guys from London. Do you like to take any questions for the AI specialist?
Thank you, and I must too confess a conflict of interest in that I'm involved in AI and endoscopic interpretation of inflammatory bowel disease. But I was very intrigued to see what you're offering. The concept of reducing the time taken to make notes is a material advantage. The question, though, that I have is how you translate it into practice. Just tell me about your journey with Preceptor AI and implementing that in Thailand, simply because that's a ready example. Where are you, and where do you see yourself being in a year's time?
Okay, thank you. Okay, first, I think for the AI, because Sila Hospital also partner with the startup that before it is the Perceptor, that we also implement our AI. I mean the X-ray AI allow the 100 hospital allow Thailand. Yeah, so that is the first step. So for now, Sila Hospital also try to have the more type of the AI, the AI in the endoscope that I show you before. Yes, but for me, I think for the near future, I think I plan to expand the AI more than the Thailand. Yeah, because I think our AI is not only benefit for Thailand but for the ASEAN. I think because we have the same demographics, so it can also use at the other countries. So we also plan to expand more in other countries. But what I want to say to you, normally for our hospital, we will give the pricing for the private and the public sector different significantly. Yeah, so because what we want is not the profit, but we want the impact to help our ASEAN patients. So I think in the future our solution will expand more in other countries.
My question though was that you are an early adopter, and for most of us, we are late adopters and struggle with the technology. And how do you accept it? Because we introduced an artificial intelligence dictation system, voice recognition in Oxford. And I found myself, as the professor of gastroenterology, finding it easier just to type my own letters, which became very short and very succinct. So how are you going to address that question of uptake?
Okay. Thank you. What I want to say to you for the dictation AI or the audio AI, the technology changed significantly because the large language model like the ChatGPT. Yeah. So nowadays you don't need to do the dictation. I mean, you just talk in the long.
Yeah. No, I saw that. I was impressed.
Talk, yeah. Okay, and yeah, it gives a better result now. Yeah, in fact, like for our AI, there is like the 60,000 minutes that doctor allowed to Thailand take it, and they are very happy. Yeah, so I think it should be better. Yeah.
Thank you.
Thank you, Khop Kun Krap.
Dr. Piyalitt, I have one more question for you. So you talk a lot about all the amazing advantages of AI, but I haven't heard much about the disadvantages and any potential danger. Like in your development of AI, what measures you taken to address that no danger comes with AI, and also for me, for example, a patient-doctor relationship is a very important element of medical care, and how do you ensure that the patient-doctor relationship isn't compromised with the use of AI?
Okay, that's a very good question. And in fact, I developed this AI to improve the doctor-patient relation. Yeah, because like for the audio AI, what we plan is like for the doctor to have more time to really talk with the doctor, with the patient, not just typing at the keyboard. Yeah, so this is our way to improve the doctor-patient. Yeah, but for the disadvantage, I still afraid of the in the medical education, because for now, like the Preceptor AI, we open around the 1 year, and I see that many medical students ask the AI to write the medical report, and yeah, it's they ask many things that I think it will make the learning process poor. Yeah, so now we try to block that. Okay, our AI cannot like the medical report or the other things. So I think we need to balance between the utilize the technology and also our medical students should have like the better way to learn, not only just the art and the AI and they get the answer. So because finally, I think if in case that they go to like in the emergency room or the rural hospital, sometimes it have no AI. So if they don't learn as we learned like 10 years ago, I think it will have problem with our medical education system.
Okay, thank you very much for your excellent talk. Any other questions? Okay, if not, I'll now like to close the session and we'll move on to the next session. Thank you very much.
Khop Kun Krap. Thank you everyone.